There's something hiding in millions of American homes right now. In garages, in sheds, in cabins, in basements. Something so small you could never see it, and so dangerous that nearly half the people who encounter its worst form don't make it through. And the group it hits hardest? Adults over 60. Not because of anything they did wrong, but because of changes happening silently inside the aging body that most people never hear about until it's too late. Today we're talking about hantavirus pulmonary syndrome. And I want to be clear with you from the very beginning, this is not a scare piece. This is not designed to make you afraid to walk into your own backyard. This is the kind of honest, specific, practical information that your doctor genuinely may not have time to sit down and walk you through. The kind that could change what happens to you or someone you love. So stay with me, because what I'm going to share in the next several minutes is something I wish every adult over 60 knew before spring cleaning season, before the cabin trip, before they picked up that broom in the storage shed without thinking twice about it. Let me ask you something first, and I mean this genuinely. Where are you watching from right now? Are you in a rural area, a mountain town, somewhere with a yard or outbuildings? Drop it in the comments. Because where you live actually changes your risk profile when it comes to this particular virus, and I'd love to know who's watching and where you are. Type your state or country down below. I read every single comment on this channel, and your location matters more than you might think. Now, what is hantavirus, and why does it affect older adults so much more severely? Picture your lungs for a moment. Not as abstract organs, but as something alive and dynamic. Thousands of tiny air sacs, like delicate little balloons, constantly expanding and contracting, moving oxygen into your blood and carbon dioxide out. They're incredibly efficient. Under normal circumstances, hantavirus doesn't attack from the outside. It doesn't cause a rash you can see or a cough you can immediately trace to something. It begins in a place most people never think about, the microscopic lining of your blood vessels. The virus targets the cells that hold those vessels together, the endothelial cells, and it begins quietly destabilizing them. And as those walls weaken, fluid starts seeping through, into the surrounding tissue, into the lungs themselves. That's where hantavirus pulmonary syndrome gets its name, and its danger. The lungs begin to fill, not from outside but from within. And what starts as a feeling of being a little short of breath can become a genuine inability to draw air within a matter of hours. The CDC has documented the case fatality rate of hantavirus pulmonary syndrome at somewhere between 38 and 50%. That's not a small number. That's not a fringe statistic. Nearly 1 in 2 people who develop the severe form of this illness don't survive it. And yet, most adults over 60 have never had a single conversation with their doctor about it. Here's why that matters so specifically for people in their 60s, 70s, and beyond. As we age, and this is just honest biology, not doom and gloom, the efficiency of the immune system changes. The mucociliary system, those microscopic hair-like fibers lining your airways that act as your body's first filter against inhaled particles, becomes less effective with age. Where a younger person's airways might catch and clear a threat before it reaches deep lung tissue, an older person's airways simply don't have the same speed or coordination. What gets intercepted at the top of the respiratory tract in a 35-year-old might travel all the way to the alveoli, the deepest part of the lungs, in a 70-year-old. And that's exactly where hantavirus does its most serious work. So how does someone actually get infected? This is the part I want every single person watching to really absorb, because the answer is not what most people assume. You don't get hantavirus from seeing a mouse. You don't get it from having one run across the floor. The primary route of infection is breathing, specifically breathing in particles that have been contaminated by infected rodents. Deer mice are the primary carrier in North America. They carry a strain called sin nombre virus, which actually translates somewhat eerily as the virus with no name. These mice almost never get sick themselves. They simply carry the virus in their saliva, their droppings, and their urine, and they shed it constantly, silently, and invisibly. When a deer mouse inhabits an enclosed space, a garage, a garden shed, the walls of a cabin, an old truck that hasn't moved in months, it leaves traces everywhere. And when those traces dry out and get disturbed, When someone moves a box, sweeps a floor, shakes out an old blanket, those particles become airborne. They attach to dust, they float, and they can remain viable and infectious in sheltered, dry environments for longer than most people would expect. Here's the detail that catches people completely off guard. You don't have to see droppings. You don't have to smell anything. A space can look and feel perfectly ordinary and still carry a real risk, particularly after a season when it's been sitting closed and undisturbed. Now let's talk about what the illness actually feels like, because this is where things get genuinely dangerous in a very specific way. The incubation period, the time between exposure and first symptoms, ranges from about 1 week to 8 weeks. Most people begin feeling something between 2 and 4 weeks after exposure. And during that entire window, they feel completely fine. No warning, no indication whatsoever that anything is happening inside them. When symptoms do begin, they arrive in a form that's almost designed to be misread. Fever, deep muscle aches, especially in the thighs and lower back. Fatigue, sometimes nausea. It feels like the flu. It feels like what you caught from someone at the grocery store. It feels like something you can rest through. And here's where things become critical. Within 4 to 10 days of those first symptoms, in people who develop the pulmonary syndrome, the disease shifts. The shortness of breath begins. And unlike most respiratory illnesses, this one doesn't ease in with a mild wheeze and gradually build over days. It can move from mild breathlessness to severe respiratory distress in as little as 24 to 48 hours. Oxygen levels drop. Blood pressure falls. The heart begins struggling. And at that point, a person often needs mechanical ventilation within a single day of noticing their breathing is off. There is currently no antiviral medication that specifically treats hantavirus. No drug you can take to clear it. Treatment is entirely supportive: oxygen, ventilators, intensive care, time. Which means the most powerful thing available to you is not a treatment. It's recognition and speed. Let me tell you about a man I'll call Gerald, a real case composite drawn from documented public health reports. Gerald was in his early 60s, retired, in reasonably good health. He spent a weekend clearing out a barn on his rural property. Perfectly normal activity. He'd done it before. He wore no respiratory protection because nothing about the job seemed unusual. 2 weeks later, he developed what felt like a stubborn cold sliding into pneumonia. Within 48 hours of being admitted to hospital, he was on a ventilator. He survived, 18 days in intensive care. But his pulmonary rehabilitation lasted the better part of a year, and he described his lung capacity afterward as never quite returning to what it had been before. That's not a dramatic, rare story. It's a pattern seen repeatedly in documented cases across the American Southwest, the Pacific Northwest, and rural areas throughout the mountain states. And this is the part I find most important to share with you. It's not that Gerald was reckless. It's that he didn't know what to look for. He didn't know to protect himself because nobody had ever told him this was something to protect himself from. And that gap, that absence of specific, honest information, is exactly why we're having this conversation today. Now, I want to walk you through the practical knowledge that actually changes your risk. Not in vague terms. Specifically, the first thing, and please do this genuinely, not just nod along, is to walk through every enclosed space on your property with fresh eyes this week. Garage, basement, garden shed, any outbuilding, any vehicle that's been sitting unused for a season. You're looking for the signs: small dark droppings about the size of a grain of rice, gnaw marks on wood or cardboard, shredded nesting material, grease smears along baseboards where a rodent travels a repeated path. Open the doors before you walk in. Let the space air for at least 30 minutes before you enter. And if you find evidence of activity, don't sweep it. Don't vacuum it. Don't blow it out with a leaf blower. That's the one action that turns a manageable situation into a serious one. Which brings me to something most people get completely wrong: cleanup. The CDC protocol for cleaning spaces with rodent activity is specific, and it matters. You wet the contaminated area first, thoroughly, with a disinfectant solution or a mixture of bleach and water, roughly 1.5 cups of bleach per gallon. You let it soak for 5 minutes. Then, wearing an N95 respirator, not a surgical mask, not a cloth mask, a genuine N95 that seals around your face, and nitrile gloves, you use paper towels to collect the dampened material and seal it in a plastic bag, then into a second bag. The reason for the wet method is simple. Wet particles don't become airborne. That single step may be the most important protection this entire conversation gives you. And speaking of the N95, please don't assume a standard mask will do. The particles that carry this virus are small enough to flow around the edges of loose-fitting masks with every single breath you take. An N95 costs a few dollars at any hardware store. It's a genuinely meaningful investment. Now, I want to pause here for just a moment because if this information has been useful to you, and I hope it has, please take a second right now and hit the like button and subscribe if you haven't already. I put together content specifically for adults over 60 every single week, and the way this platform works, your engagement is what makes sure these videos reach the people who actually need them. Share this one with someone in your life who spends time around older buildings or rural properties. That's the kind of share that genuinely matters. Back to the piece of this that I think is most overlooked. Knowing when to act fast. If you or someone you love has had any potential rodent exposure in the past 1 to 8 weeks and begins developing a combination of high fever, deep muscle aches, and progressive shortness of breath, even mild shortness of breath that seems to be getting worse over hours, that is not a situation for a doctor's appointment in 2 days. That is an emergency room today. And when you walk in, you say it clearly and specifically, I may have been exposed to Hantavirus. I was near rodents. I need to be evaluated for Hantavirus pulmonary syndrome. That sentence matters. In a busy emergency department, this diagnosis isn't the first thing on anyone's list. You are your own most powerful advocate in that moment. Being specific, being clear, and naming the exposure history gives your treating physician the information they need to act quickly, and in this particular illness, quickly is everything. There's also something worth understanding about how older bodies experience illness differently. Research has described a phenomenon sometimes called inflammaging. The idea that as we age, our immune response becomes paradoxically both slower to ramp up in the early stages of infection and more chaotic once it does. What this means practically is that an older adult may feel less acutely sick than they actually are in the early hours of a serious illness. The warning signals can be quieter, which is exactly why knowing the specific symptom pattern matters so much, because you can't always rely on how bad you feel to tell you how serious the situation is. There's one more thing I want to leave you with, and it's the action that I genuinely believe makes the biggest difference. Have a conversation with your primary care doctor specifically about your personal exposure risk before anything happens. I know that might sound less dramatic than the rest of what we've discussed. But here's the reality. Fewer than 1 in 10 adults over 65 have ever talked to their doctor about diseases transmitted from animals to humans. And yet your physician can do something no mask or cleaning protocol can. They can know you. They can note on your chart that you spend time in a cabin, or that you maintain a property without buildings, or that you have a history of rodent exposure in your area. They can review whether any of your current medications affect immune response. And if you arrive at an emergency room in respiratory distress, that note on your chart could be the thing that connects the dots immediately. Walk into that conversation prepared. Say, I want to talk about hantavirus risk. I spend time in spaces that may have had rodent activity. What should I know, and what do you need to know about me in case I ever get sick? That conversation, for someone in their late 60s or 70s living in or visiting the American Mountain West, the Pacific Northwest, or any rural area with regular rodent activity, that conversation could be one of the most important ones you have this year. Let me bring everything together for a moment because I want to make sure you're leaving with what actually matters. Hantavirus pulmonary syndrome is real, it's serious, and it disproportionately affects older adults. Not because of carelessness, but because of the natural biology of aging. It spreads through the air in enclosed spaces contaminated by infected rodents. It begins with symptoms that mimic the flu, then escalates, sometimes within hours, to severe respiratory failure. There is no specific treatment, only support. And the two most powerful things available to you are preparation and speed. Do the inspection. Get the N95. Learn the wet cleaning method. Know the symptoms that demand emergency action. And have that conversation with your doctor. You are not helpless here. Not even slightly. The people who come through situations like this, the ones who recognize the signs, who act without hesitation, who have already armed their physicians with the right information, they're not lucky. They're informed. And today, you are. Before I go, and I want to hear from you on this, have you ever been in a situation where you cleaned an old shed or storage space without thinking about respiratory protection? Most of us have. There's no shame in it, we just didn't know. Drop your answer in the comments, and while you're there, tell me how old you are and what part of the country you're in. That feedback genuinely shapes what I cover next, and I read every single one. A quick note before we part. Everything I've shared today is meant to inform and educate, not to replace the guidance of your own healthcare team. If you have specific health concerns or are thinking about making major changes to how you approach your environment or your health routine, please talk with your doctor or a qualified medical professional. They know your full picture in ways no video ever can. Thank you for spending this time here. Share this with someone who deserves to know it. And I'll see you in the next one.